He put us at ease. He was so relaxed and so positive about what the outcome would be.
If you can get someone seizure-free and improve their quality of life, that's why you come to work.
I would do it all over again, and I wish I'd done it sooner. It's just totally been a miracle for me, giving my life back.
kxly-4 presents Spotlight on Health, Neuroscience, brought to you by Providence Healthcare.
From detection to treatment to rehabilitation, the neuroscience programs at Providence Sacred Heart Medical Center are the region's most comprehensive resource for the treatment of illness or injuries to the brain or spine. The expert medical teams here utilize the most advanced technology, offering progressive medical and surgical treatments in virtually every neurological field. A certified stroke center, the #1 hospital in Washington for spine surgery. A neurosurgery center utilizing breakthrough treatments. An epilepsy center offering the region's only epileptologist. One hospital, one goal: provide exceptional, compassionate, and easy-to-access care for patients with neurological diseases and disorders. Hi, I'm Nadine Woodward. Neurology is an area of medicine that can seem intimidating, and having to see a neurologist, well, that can be daunting and a bit scary. But the professionals at Providence Sacred Heart's Neuroscience program want you to know that they are here to provide the most comprehensive care available, and in many cases, the best care in the region.
I had no quality of life. The pain was so bad that I couldn't even hardly walk.
Like many people, Jim White suffered through back pain until he could no longer live with it.
The most important thing is that we have a lot of people that are cared for here with problems like this. And as a result of that, we're very used to dealing with patients with spine problems, and that makes it easier for us to do a good job.
Dr. Dean Martz is one of the highly dedicated neurosurgeons on staff who deals with spinal problems.
Inland Neurosurgery and Spine is a group that has been working in Spokane for decades. We have 6 surgeons total, 5 neurosurgeons and 1 orthopedic spine surgeon, and all of us take care of people with back and neck problems.
You hear horror stories, and in fact, the last neurosurgeon that I talked to a couple of years ago explained that it was really a very, very tough surgery. You have a lot of surgery, a lot of pins and bushings and rods and screws and all this kind of stuff, and he just basically scared the heck out of us.
I think all of us try to keep the surgery as limited as possible, and by doing that, the recovery is a little bit easier because obviously with a more limited operation, people will improve more quickly.
He put us at ease. He was so relaxed and so positive about what the outcome would be that we were really pleased to do it.
Jim's initial fears were subsided with the approach taken by the Inland Neurosurgery and Spine team.
When you're doing surgery, sometimes you need to make a large opening to do an extensive operation, but when you can do the surgery with a small opening, that is always much better. And this is where our technology really comes in handy.
It's these kinds of advanced technologies that set Sacred Heart's spinal program apart from the rest.
When we are doing fusions, which sometimes involves putting screws in the spine, rather than make a big operation and a big opening and see every available piece of bone in the spine, we now do the operations through smaller openings and use X-ray machines to help us guide the screws into the right place. One particular machine is called the O-arm, which is a mobile CAT scanner, and Sacred Heart is the only hospital in the area to have one of these. This shows us a picture of the spine in 3 dimensions and makes it extremely safe to put screws into the spine. The O-arm allows you to see the cylinder completely. Once we have that, then we use special instruments and image guidance technology that let us feed the screw perfectly down through the center of the cylinder. By using our technology effectively, we can keep the incisions smaller and make the recovery go easier.
Recuperation time was very, very good. Within 5 weeks, I was walking a mile, and that gradually increased whereas now I'm walking about 4.5 miles.
Once someone comes to the hospital, they're in an environment where they're going to be well cared for, because we do a lot of operations of this kind here all the time, and I think that makes it easier for people to recover quickly while they're in the hospital and get their recovery at home started out on the right foot.
I have no problem telling anybody, don't live with the pain, get it done.
Another part of the critical care at Sacred Heart, and one making huge strides for its patients, is the comprehensive tumor program.
Tumor surgery intracranially is a rather intricate procedure, and obviously when we are operating on brain tumors, we'd like to know where we are in three-dimensional space, on the surface as well as within the head. And so technology has been available now for the past decade to allow us to be more accurate in our navigation in this manner. So what we have here is the sort of latest setup that we have at Sacred Heart to allow that navigation to proceed. So this allows for surgery to be more accurate. We can create smaller openings in the skull to target tumors better. We can use this technology to plan trajectories towards the tumor if, say, the tumor is deeper within the brain as opposed to the surface of the brain. And it really makes for a much more comprehensive way to treat these things surgically.
For tumors too small or too deep in the brain, the latest in radiation treatment is a good alternative.
The current status of radiation nowadays is that you can have sort of different modes of radiation applied to tumors. You can have sort of like a whole brain radiation, or more coned down radiation, or you can have what's known as single fraction or single dose stereotactic radiation, where you have beams and arcs of radiation that then converge upon a single spot. This picture here outlines the current plan of radiation for this particular patient, where these sort of arcs that you see here actually represent the arcs of radiation that are being delivered to this patient in these particular planes. And so you can see that they all kind of converge upon this tumor that's located behind this patient's eye. This technology is nice in that a lot of times you can just give the treatment in just one dose, because you are concentrating the radiation to a degree right on the area to be treated. When we deliver the radiation, it's very important to have the patient's head very still, because obviously any sort of movement during the procedure can really throw off what's being delivered and what's being radiated. People who have been accustomed to dealing with stereotactic radiation in other centers may be familiar with the rigid fixation with the pins, but now that we are able to do this with a mask system, which is more comfortable usually to the patient. Obviously, when you're dealing with tumors, the surveillance and the amount of time that you are from treatment is the key factor, whether the tumor is still going to grow or the tumor is going to shrink or not. So far, initial surveillance scans we've had are very promising.
When we come back,
If you can get someone seizure-free and improve their quality of life, that's why you come to work.
Why did the Hospital Value Index rank Providence Sacred Heart Medical Center as the best in value hospital in the entire state of Washington? Because of our quality of care, the superior patient satisfaction ratings we receive, and our leadership in providing care more efficiently so that it's more affordable and more accessible to more people. Providence Sacred Heart Medical Center. Care for life.
Right now, he's not thinking about what would happen if he had a stroke. He hasn't measured the benefits of neuroradiology. He hasn't formed a team of stroke specialists who are available around the clock. He hasn't thought, what if? But we have. It's part of being the region's premier medical center, and why Sacred Heart built the region's only certified stroke program.
would you be able to recognize the signs of a stroke? Would you know what to do if you or someone you know was having one? Increasing stroke awareness is priority one for Providence's Comprehensive Stroke Center.
The most common type of stroke is when a blood clot goes up into the brain and blocks a blood vessel, so that blood's no longer able to get to that part of the brain and bring it oxygen, bring it the food and nutrition that part of the brain needs to survive. So sudden onset of symptoms that have never been there before, typically numbness or weakness, trouble speaking or finding the right word, sudden difficulty walking or sudden trouble seeing, and the acute onset of the absolute worst headache of your life. Those would all be big warning signs that would require acute medical attention.
Dr. Garrity is passionate about getting the word out on stroke awareness and the importance of immediate treatment.
We usually recommend something called the FAST scale, which is very easy for people to learn, and it's something that all of our paramedics do as well. So it stands for face, arm, speech, and time. So the first thing you do is for face is you ask the person to look at you and smile. And if one side of their face doesn't come up, that's abnormal. The next thing you do is you ask them to lift up both their arms, an A for arms. And if one arm isn't coming up well, then that's not normal. And then the last thing you do is you ask them to say something. The S is for speech. And if they can't say the words correctly or the words come out slurred like there's cotton in their mouth, then that's abnormal. So now you have F, face, A, arm, S, speech, and then T is it's time to call 911.
That awareness that a stroke is happening means time is of the essence in getting to the hospital.
Every second, every minute, every hour is critical. In fact, when we've looked at it, a person who's having a stroke is losing 32,000 brain cells every second and almost 2 million brain cells every minute that clot is sitting in their brain. If a person can get to the emergency room quickly enough, we can deliver life-saving treatment, which is the intravenous TPA, but we only have a few short hours to do that.
Fortunately for those in need, we have 2 certified stroke centers in the Spokane area with the recent addition of Providence Holy Family Hospital. Likewise, Providence Sacred Heart holds a Gold Plus certification, a national distinction.
One of the things that makes the Providence Sacred Heart program more than just a primary stroke center, but truly sets it above the rest, is our fabulous neurointerventional program. We are blessed in having some well-trained neurointerventional radiologists who allow us to treat strokes above and beyond intravenous TPA. When a clot has been there longer than we can get to it within those first few hours, or it's a particularly resistant clot, our interventional team has the capability of taking a catheter and chasing that clot through tiny blood vessels under X-ray guidance and trying to manually pull that clot out with catheters.
Doing all they can for patients affected by stroke means everything to Dr. Garrity and her team.
We're very proud of every single member of our stroke team who's cared for these patients the moment they come through the door, and that's what makes our stroke center an excellent center.
Another example of leading neurological care at Sacred Heart is the Providence Epilepsy Center, a program dedicated to treating patients with the utmost care as they deal with this common disease.
It just takes 2 seizures to get the diagnosis of epilepsy. So 1 out of every 100 people have epilepsy. So that's over 2,000 people in Spokane who have epilepsy.
Trying to understand and control seizures is the primary goal of Dr. Tim Powell and his physician assistant, Amy Gregg.
Epilepsy is one of the most common neurological disorders, and so all neurologists and even primary care physicians will work with patients with epilepsy. It's the patients where you're not sure if they're actually having epileptic seizures, or if they are having seizures, how come the medicines aren't working, or do you think this is epilepsy or not, when it takes a little more in-depth research and in-depth workup and understanding, then they will be sent to me.
As the region's only epileptologist, Dr. Powell has the expertise needed to make critical diagnosis for patients with epilepsy.
An epileptologist is a neurologist who does specialized training in epilepsy, so it's extra training after what you've done in your normal medical training. and you deal only with seizure patients, and you also are responsible for reading EEGs, which are the measurements of the brain waves that we look at in the epilepsy patients.
He spent hours and hours being mentored and learning how to read EEGs. And the thing about EEGs are they're not a simple thing. If you put an EEG in front of two neurologists and they could come up with very, very different readings. And it really makes a difference to have somebody trained who really has read a lot of EEGs, because major decisions are made based on the EEGs.
But it is the team approach that serves the patient in this center the most.
Truthfully, sometimes Amy will pick things out that I didn't see, and there's other times that Amy will come to me with a question and we'll be able to problem solve things together.
The part that I didn't realize was how rewarding it was going to be working in epilepsy, and how this field draws in so many parts of the patient's life. We hear so much about how the disorder affects them, and that's what's really motivating to me, is just all the different ways that it affects people.
That's it. I mean, I just have a desire to help these people with epilepsy. It's a very common disorder, and it can be very debilitating. It affects all patients, all age groups, and it really affects quality of life. It's interesting because there are components of physiology, there's components of neurology, there's components of psychology, and all this stuff combines into these patients because it all plays a factor into their quality of life and their family issues. It's not a disease of the individual, it's actually a disease of families, because it affects all of them. And so if you can get someone seizure-free and improve their quality of life, that's why you come to work.
Caring people doing very special work. Up next.
I would do it all over again, and I wish I'd done it sooner. It's just totally been a miracle for me, giving my life back.
She doesn't spend her days thinking about the finer points of delicate spine surgery. She hasn't built the most comprehensive neuroscience facility in the region. She hasn't helped pioneer less invasive microsurgery techniques. No, spines are not her specialty, but they're one of ours. So it was no surprise when HealthGrades recently rated Sacred Heart #1 in Washington for spine surgery.
Why did the Hospital Value Index rank Providence Sacred Heart Medical Center as the best in value hospital in the entire state of Washington? Because of our quality of care, the superior patient satisfaction ratings we receive, and our leadership in providing care more efficiently so that it's more affordable and more accessible to more people. Providence Sacred Heart Medical Center. Care for life.
People diagnosed with essential tremor and Parkinson's disease are often sentenced to a life of debilitating tremors, shaking so severe they can no longer work or perform routine tasks like holding a spoon or a fork to feed themselves. Fortunately, there's a procedure called deep brain stimulation that can give these patients a new lease on life.
My hand it was constantly like this. It was, both hands were. And the first doctor that I talked to, like I say, there was a lot of older people in that waiting room, and so when he told me I had Parkinson's and he watched the other patients in there, you go, wow, I don't want to end up like this.
Because I was diagnosed 15 years ago, and up until about 5 or 6 years ago, I was controlled pretty well with medication, and then that began to not work so well. And
in about 2001, I was diagnosed with Parkinson's at 38 years old, which is pretty young, and progressively gotten worse over the years.
Within the field of neurosurgery and neurology, I think deep brain stimulator is one of the most exciting and really phenomenal treatments that we have. Most of what I do in neurosurgery is preventative, or it's treating really catastrophic things that have happened to people. But deep brain stimulation, it fixes people, it makes them better. It takes them from a state of disability and returns them into a state of function.
For people like Tom, Mike, Lori, and Shane, the continued loss of control of their bodies gave each of them a bleak outlook.
As an electrician, we get to work on some hot electrical panels and things, and it's kind of shaky to worry about going into an electrical panel with your hand shaking.
I got to the point where the medication, there was too much high and low, and it was not working the way that I needed it to even be able to function. For a while, I wasn't able to even write with my right hand without taking it and pushing it along.
And what were your options at that time?
Well, it's nothing, like you said, just deal with it. Just deal with it. But he says, you've got about 5 years. At the end of 5 years, you will have to do something, because it'll have gotten to the point where you're going to have to make some choices.
Well, it was taking away my ability to really be able to plan to do much of anything from day to day, because it was so erratic as to whether or not the medication would work from day to day.
To place a DBS system in the brain actually is 2 surgeries. The first surgery places the wires into the brain. That's the critical surgery. The second surgery comes back a week later and puts wires in connection down to a pacemaker-like device that sits under the chest. The goal of the surgery is to place these small wires into a very tiny location of the brain called the subthalamic nucleus. It's about the size of a small almond. And so we use many different pieces of equipment and different techniques to make sure we're getting into the right spot. Then we stimulate the brain with electricity, and we see if it has an effect on their tremor or their stiffness.
Okay, so this is our planning software, where we merge the different images that we've collected about this patient's brain, and we pick the target we're going to go to inside the brain tissue. It's a very sophisticated software that lets us do this planning. Okay, are you comfortable?
Yes, I am.
Does your neck feel good? You ready?
Ready.
Okay, let's do it.
Okay. How are you doing this morning?
Doing great. How about you?
I'm doing good.
So this is called our phantom base. It simulates where we're going inside the brain. So I set the coordinates in the brain on the phantom, and I set the coordinates on the arc, and we make sure that they line up together as a double check.
During the deep brain stimulation wire placement, there's multiple steps in the process. The first step is we bring you into the operating room, we get you situated very comfortably on the bed. The second step is we give you some sedation so you're asleep. We make 2 small incisions on your head behind the hairline, and then we drill some holes so we can get down to the surface of your brain. Then you wake up and we begin the surgery when you're awake. Now, it's remarkable, but the brain has no sensory fibers, so you can't feel anything when we're doing things in your brain.
Okay, she can start waking up now.
Okay, thank you, Bob.
Nice brain. Sandy, are you awake?
The brain has billions of neurons, and neurons communicate with each other. And they communicate through what are called action potentials, which is a small discharge or depolarization of the neuron. With a microelectrode, we're actually able to hear and pick up those discharges. One of the things that microelectrode recording is very good for is helping us define where we are in the patient's brain. It verifies for us that we're passing through the targeted region, and it lets us very precisely put that wire within sub-millimeter accuracy in the brain.
Okay, all our coordinates are double checked and we're ready to go in. So we're going to advance this little microelectrode now.
Pressure's 117.
Okay, we're all hooked up to the microelectrode. Let's see if we got some signal. So it looks like there's some kinesthetic cells in there that are responding to activation of our arm. So this is the DBS wire we're going to put inside the brain. It's got 4 little contacts, and we can stimulate each of those little metal contacts through our stimulator.
And here they are working on your brain, and you're not feeling anything.
Not feeling a thing, wide awake.
Was it weird?
It was weird. It was kind of exciting in a way, strange, but it was good. I had no pain memories.
When we're stimulating, we're of course testing the patient, and we have them move their hand and look for their tremor, and we move their arm to look at the stiffness and see how fast they can open and close their hands, which is a sign of the slowness.
Stimulating at 3 and 4 volts now.
Feeling anything here?
Much more
better amplitude.
How far does that go into my brain?
Well, it goes about 5 or 6 centimeters. It goes a ways down in there. Excellent, looks good, okay. So we've taken an intraoperative CAT scan with a wire in the brain while we're in the operating room still, and we've taken those pictures and put it onto our planning station, and we can verify that the wire is exactly where we wanted it to be.
The deep brain stimulation procedure is truly revolutionary, especially when you see the dramatic results.
This is Shane Nilsson, and he's a gentleman with Parkinson's disease. He was diagnosed 9 years ago, and in April of this year, of 2010, we implanted deep brain stimulators for treatment of his Parkinson's disease. And to start with, Shane's device, like I said, is off, and now I'm just going to turn it back on.
We've been very fortunate. Dr. Hirschauer and I started doing this procedure 14, 16 years ago now, and then we brought in Jamie Mark as a nurse practitioner, and she's been with us for 10 years, and now the addition of Dr. Carlson as a surgeon as well. We're very fortunate, and I think we have done as many cases as you know, a lot of the big centers on the West Coast, and we're having great success, and the patients, you know, will tell you.
As a Parkinson's patient, you feel like your whole life's kind of being taken away from you in some ways. So to have that feeling of you're under the right care was so important. And this surgery did so many wonderful things. It really gave me my life back.
Do you feel like you have a new lease on life?
A new, very, very much. If anybody that has the tremors of any kind, Parkinson's, essential, I would go for this procedure any day of the week. It's actually brain surgery, but it's worth it.
People come up to me and they say, "Gosh, Mike, you know, you're doing really good." And I go, "What are you talking about?" And I go, "Oh yeah, I've got Parkinson's. I forgot about it." You know, really, I mean, I don't have the tremors.
Okay, so let's turn your stimulator on.
Okay, good beat. Ooh, I get a little rush there for just a second.
There went your tremor.
My advice for anybody that's considering it is not to be afraid to do it. I mean, it is brain surgery, but it wasn't nearly as traumatic as what I thought the experience would be. And for the good and the benefit that it's given me, if I had to do it once every year to keep going like this, I'd do it in a heartbeat. I would do it all over again, and I wish I'd done it sooner. It's just totally been a miracle for me, giving my life back.
As you've seen in this half hour, the Providence Neuroscience program offers not only cutting-edge treatment, but also exceptional and compassionate care. I'm Nadine Woodward, and thanks for watching.